Hey everyone, and welcome to Explore Your Roots. On today's episode, we are sitting down with our in-house doctor here, Dr. Dennis Crandall, to talk about the health of our ancestors, specifically when it pertains to a condition or disease called atherosclerosis. Before we jump in, consider giving us a follow on our social media pages on Instagram, Facebook, and TikTok, as well as following us and subscribing to us on YouTube, Apple Podcasts, and Spotify. Also, if you're watching this episode or listening to it on our podcast, you can check out the written article we posted on our website, exploreyourroots.org, and I'll leave a link to that in the description. All right, let's get started. Okay, so today we are sitting down with our doctor here, Dr. Dennis Crandall, clinical professor at the University of Arizona School of Medicine and adjunct associate professor at the Mayo Clinic College of Medicine in their departments of orthopedic surgery. He teaches medical students and residents, does spine research, takes care of professional and college athletes, invents new surgical techniques, and specializes in all things spine related. So since this disease, atherosclerosis, is so common, it maybe could have affected some of your ancestors. So today we thought it would be interesting to actually go through the history of this disease and our understanding of it. So our topic of today was actually proposed by Dr. Crandall, which is about atherosclerosis. So to begin, Dr. Crandall, I was wondering if you could give us a brief and easy to understand definition of what exactly atherosclerosis is.
Sure, and thank you for inviting me, and it's an honor to be the in-house physician for Explore Your Roots. I would say that atherosclerosis, if you think of it this way, it's clogging of your pipes. Atherosclerosis is a condition where your blood vessels develop a little focus of inflammation, which then begins to collect cell debris and cholesterol and fatty tissue that flows through your blood, and it starts to accumulate in the wall of your blood vessels. And over the passage of time, the accumulation of this debris or this cholesterol or fatty material starts to calcify. And as it develops calcium, it gets hard. And as it gets hard, it stiffens. And that is the hardening of the arteries that people refer to when they talk about atherosclerosis. So it occurs in the blood vessels of your heart. It occurs in your arteries up and down your aorta, through your chest and your abdomen. It occurs in the blood vessels in your legs. And clogging up of the blood vessels in your legs is referred to as peripheral vascular disease. It can occur in your neck. It can occur in your brain. It can be a cause of stroke and of heart attack. It's a significant problem, and it has a very large genetic component to it. But it can be mitigated with medications and with exercise and diet. There's some things that you can do to help your overall risk of atherosclerosis. But there's some things that you just have no control over. For instance, what is your family history? If you have a history of atherosclerosis, then you're probably going to have some amount of hardening of your arteries, regardless of what you do.
Awesome. Well, thank you for that definition. I think that initial genetic family history component is what sparked our interest in the first place. And then we saw and came across a couple of studies looking at mummies and their history with atherosclerosis, that it sparked this crossover between atherosclerosis and family history. So I want to kind of look at that study and some of the pictures and figures from that study that we put in our article on our website. And there are some CT scans of these mummies where they were able to identify atherosclerosis in the actual mummy. So let's take a look at that here. Okay, so looking at this image here, this is one of the CT scans of one of those mummies. And this they titled "The Common Iliac Arteries." Maybe you can correct me if I'm pronouncing that wrong. So this is looking at the heavy calcifications or the atherosclerosis in the arteries. And so this is this is from a mummy who was called a princess, who lived in 1580 to 1550 BCE. So explain to us here what you see in this image.
Well, first of all, I think that this is a great example of the notion that atherosclerosis is not a disease of fat Americans who eat hamburgers every single day and sit on the couch and play video games. Obviously, we've got a 4000 BC or whatever the year works out to be, in a civilization that is maybe agricultural, maybe, in people who certainly didn't have a diet that was heavy in fats and cholesterol like we do. And yet atherosclerosis is present. And this is a great example of what is probably the genetic part of this disease process. If you look at this view on the left, this is a cross-section of the CAT scan through the lumbar vertebra. So here is the lumbar vertebra. Here are the facet joints, or the joints in the back part of the spine. Here's the spinal canal. Now, as a spine surgeon, of course, this is the thing that interests me and catches my eye first. The back of this person comes along in this area. The muscles would be along here. And what you see in the front, where these arrows are, you see these white calcified or hardened blood vessels. And this is a great example of, and let's just break up this word atherosclerosis. There's the atheroma, which is the collection of debris and fatty tissue. And then there's the sclerosis, which is the hardening or the calcification of that plaque. And so the combination is atherosclerosis, which is exactly what we see here. Look at the buildup of the calcium deposit on one side of the vessel, and there's a part of the vessel that is not calcified on this one to the right. The one to the left looks like it might even be occluded in some way by atherosclerosis. This is the same specimen that we see on the right. Now, this view shows us what's called a coronal section. So in other words, a side-to-side slice of the body. So the vertebrae are stacked up here. And then we see the abdominal aorta come down and break into left and right common iliac arteries, which then become the femoral arteries and start their pathway down the legs. Look in this particular patient, or this particular Egyptian, I guess, look at how thorough the calcification is in each of these sections of the blood vessels, of the iliac arteries in this case, and ascending upward in the abdominal aorta. It's not universal. It's kind of spotty. And so you see some calcification in some areas, which reflect the areas where the plaque was, and the areas that have become calcified and are. It's effectively like having bone inside your blood vessel.
Awesome. Well, that is very interesting, looking at this Egyptian mummy. Okay, so if we come to this next one, of a mummy of a man, I guess, who lived also around the same time, 1550 BCE. So what can you tell us about this one?
All right, so what we're looking at here is, this is a side view. Obviously, you see the teeth, you see the jaw, you see the back of the skull, and then this is the very top of the cervical spine in this particular specimen. The arrow is pointing to a calcification inside the carotid artery. Now, the carotid arteries are the arteries on either side of your throat that come off from the top of your aorta in your chest and ascend up through your neck, and then they enter into your brain, and they provide the blood supply to your brain effectively. And so if you have clogged arteries in your neck, if your carotid arteries are occluded because of large chunks of cholesterol that have now turned to calcium and to bone, then you can have a stroke. And so this is a significant health problem that is watched closely in patients who are prone to atherosclerotic disease, and the neck is one of the places that you look for it. And looking at this cross section, now the one to the right, number B here, is a cross section, and you can just see the top part of the cervical spine here, or the neck. And then the arrows are pointing to these white circular areas, which are calcified blood vessels in this old patient. How old was this person again?
They didn't say the age, but they say they lived around 1550 BCE. So I'm not sure.
So,
it was a man. I know that, but
so 2,000 or 3,000 year old person. So again, this just points to the notion that hardening of the arteries, the arteriosclerosis or atherosclerosis condition that people develop, may have some component that's related to what you eat and other conditions, but it certainly has a component to your genetics or your DNA. And that's what we're looking at here. And this is a several thousand-year-old person. This is not somebody eating cheeseburgers, which just goes to show in people who have atherosclerosis, there probably are only things that you can do to mitigate or to slow down the progress of the disease, but you can't eliminate it. If the Egyptians had it and they never ate hamburgers, then our best chance is a balanced diet, good exercise, watch our blood pressure, control the amounts of fat that we eat, and if our cholesterol gets elevated, take a statin medicine to help lower the cholesterol, and we do the best we can. It might be that after all is said and done, that the best thing you can do is have your hardening of the arteries progress slowly. It might be that they're going to progress no matter what you do, but the best you can hope for is that they progress slowly.
Okay, so let me read off a couple of the facts from this study, or a couple of their conclusions. So in all of the CT scans of these mummies, they found that 25 to 40% of all the mummies they studied, which were from Italy, Peru, Alaska, Greenland, and Egypt, all had atherosclerosis. So that's a pretty big majority. I believe also, going throughout the history of this, in modern times, it was around 1913 that doctors were able to finally identify cholesterol as a key in the development of atherosclerosis. And then it wasn't until 1950s and 1960s that medicines and diets were identified that can or to help lower cholesterol. And so I guess today about 90% of people over 30 have atherosclerosis, and it's responsible for about 75% of heart-related deaths each year. So that's a pretty big number. And you talked a little bit about some of the things we can do. So there are some risks, in our life that we can't control, such as high blood pressure, smoking, eating high fatty foods. But there are others that we can't, or that are beyond our control, such as our genetics and family history. So that's kind of the fun area where it crosses over, and where it can become really interesting to us to look at our ancestors and how they ate, and how their genetics affected them, and how that can maybe possibly affect us. So just as our modern era and culture struggle with atherosclerosis, our ancestors did also. Lucky for us, we now know this and can do our best to treat and mitigate it. So may your arteries harden very slowly. And if you enjoyed this episode, again, give us a follow and like this video or podcast and share it with your friends. And we'll see you next time.